A myth about cognitive therapy is that it's the power of positive thinking. That's really quite inaccurate. Cognitive therapy really is the power of realistic thinking. It is not just helping the patient develop a rosy picture of his experience and what's going on in the world. If we did that, that would be providing a disservice to patients because their experience is not necessarily rosy and the world is not necessarily rosy. However, when patients come to see us, they're usually in distress, and frequently their thinking is unrealistically negative. We never know when we hear a patient express a thought that he's been having, whether that thought is 100% true or 0% true or someplace in the middle. And so one very important thing we do is to help patients evaluate their thinking. We ask questions such as, what's the evidence that this thought is true? Do you have any other evidence? Is there any evidence on the other side that maybe it's not true? Is there another explanation for what's going on here? So we ask them a series of questions to help them figure out to what degree their negative thinking really is realistic or unrealistic. And if unrealistic, we help them develop a more realistic view, which for most patients is in a positive direction. But it's not the power of positive thinking, it's the power of realistic thinking. And in fact, when we work with patients who have bipolar disorder, who are in a manic episode, their thoughts are hyper-positive. And so when we do some reality checks with them, we're helping them actually change their thinking in a more negative direction so that it's more realistic. And we sometimes find this same kind of hyper-positive thinking with some other patients as well.